Mr. James was an elderly male with underlying health conditions who lived at the Texas Masonic Retirement Center in Arlington. He and his wife lived in one of the cottages, but they did participate in activities in the cafeteria of the main facility. We have epi teams who are currently investigating all potential contacts, both at the center as well as at the hospital. The Arlington Health Authority and the Tarrant County Public Health Authority have jointly issued control orders, which basically will allow them to interview and talk with the contacts, and then from that conversation be able to determine what the next steps may be in that particular process. You heard the governor say that they will all be tested. He was a male resident, obviously a male, who was hospitalized on Thursday, March the 12th. There was a specimen obtained on Saturday, March the 14th. He passed away early Monday, March the 16th, and the test results were obtained on Tuesday, March the 17th. This gentleman had no known travel or contacts with any other COVID-19 patient. He represented the second localized spread case of COVID-19 in Tarrant County. We currently have 9 positive cases, 2, maybe 3. We're still trying to determine on one of them whether or not it may have been local spread. This was the first death in Tarrant County. I want to applaud the Texas Masonic Retirement Home because last Wednesday, on March 11th, they actually implemented infection control procedures throughout their campus. Now with CDC's EPI team coming on board, they will sit down with them, they will review those procedures, make any recommendations of changes that might need to be made so that we can continue to do everything we can to protect the folks at the retirement center as well as other folks that the individual may have come in contact with. What I also want to tell you is that for the last several weeks, we've been having regular calls in planning for what is now happening. At the current time, we are having a call every morning with our local partners, many of the agencies that are going to be involved in addressing the needs of our public as we go through this process. And those include school superintendents, they include the chambers, they include restaurants, they include a lot of different groups, Meals on Wheels, the hospitals. And each day what we ask of them is, what problems are you encountering, or what things do we need to begin preparing for? I would note that within Tarrant County we have 41 different cities that have part of their city within the county. We have 9 cities that have their own individual plans. In addition, we have the county plan. So as we've been reacting to changes on a day-to-day basis. Many of us issued the declaration of emergency last Friday, which had certain restrictions on it. We changed those on Monday based upon what had occurred and what public health's recommendations were. We've got a newscast or a press conference this afternoon at 2 o'clock where we're going to announce restrictions that we had talked about and discussed with all the cities yesterday. But based upon happenings that occurred last night and in conversations with the governor, those may very well occur. We have to get the lawyers to come together and agree on language, but those will either occur today or we may issue another set of restrictions tomorrow. So this is something that we understand is changing, and we're going to change and be able to change on a moment's notice. I would like to just again thank the governor and the folks from the state, and we're all working together. We're all working together as a team. We have a tremendous collaborative spirit in Tarrant County. I have no doubt that with the generosity that our citizens have displayed in the past, that we are going to have more volunteers than what we're going to know to do with. And we've got organizations set up to screen and to understand and to help those volunteers find things which they can do safely in the time that we are experiencing. Again, I think this is a time we're going to get through this. We have a plan. That plan will be changing. I really believe that our folks are going to pull together and that this is going to be an opportunity for us to maybe reacquaint ourselves with our neighbors and really begin to kind of make that reconnection and kind of be our neighbor's keeper. And I would encourage folks to reach out, to call the elderly, if they have older folks that they know, to reach out to them, because this is the time when we need to be positive. We're going to get through this, as the governor said. We've just got to be prepared, and we've got to do everything we can to be proactive and not reactive.